Welcome to today's webinar, Rare Diseases Are Not Rare, a training on rare disease resources. My name is Veronica Milliner, and I'm an engagement specialist with the NNLM All of Us National Program. Before we get started on the training, I wanted to go over just a few housekeeping items to get everyone set up. So all attendees have been muted upon entry, but we welcome your questions throughout the program. We encourage interaction within the chat, but if you have questions for our panelists, we ask that you submit them using the Q&A function located at the bottom of your Zoom window. Presenters will be answering questions throughout the presentation, so feel free to submit them as we go along. And due to time limit of today's webinar, we may not be able to get to all of the questions, but we will do our best to address as many as possible within the hour. Closed captioning is also available for today's webinar. If you would like to access closed captioning, please navigate to the Zoom toolbar and look for the CC icon at the bottom. And if you require any technical assistance during the webinar, please reach out through the Q&A function, and a staff member will reach out to assist you. I just wanted to let you know this webinar is being recorded, and the video will be posted on NNLM's YouTube page in a few weeks. Everyone who is registered for this training will receive a follow-up email with PowerPoint slides, a resource list, and a link to the recording when it is ready. This class is eligible for one Consumer Health Information Specialization credit, or CHIS credit. This webinar is also eligible for one Certified Health Education Specialist credit, or CHES credit. At the end of the webinar, we'll share a link to an evaluation survey for all participants. After you complete the evaluation survey, you'll receive instructions on how to claim your continuing education credit. Even if you don't wish to receive continuing education credit, we encourage everyone to fill out the evaluation survey and provide us with some feedback about the webinar today. This webinar is supported by the NNLM All of Us National Program. The NNLM All of Us National Program is the result of a partnership between the National Library of Medicine and the All of Us Research Program. The All of Us Research Program is seeking 1 million or more people from across the United States to help speed up medical research. People who join will share information about their health, habits, and what it's like where they live. By looking for patterns, researchers will learn more about what affects people's health and what makes us healthy and what makes us sick. You can learn more about All of Us by visiting joinallofus.org/NLM. Okay, so now that the housekeeping items are out of the way, let's get started with today's webinar. We would like to extend a thank you to the National Center for Advancing Translational Sciences, or NCATS, for helping to make this webinar possible. And with that, it's with great pleasure that I introduce our two presenters for today. Eric Sid is a program officer in the Office of Rare Diseases Research, where he is the lead for the Genetic and Rare Diseases Information Center. Sid is the lead for the Rare Diseases Registry Program, which offers guidance for establishing and maintaining patient registries. He oversees the NCATS Toolkit for patient-focused therapy development, which disseminates best practices for patient-partnered research through collaborations between patients and caregivers, community organizations, researchers, and National Institutes of Health staff. Our second presenter, Meera Shah, joined the NCATS Office of Rare Diseases Research as a program analyst in December 2018. She works with the team on numerous projects and programs to advance diagnosis of and treatment for rare diseases through research. Shah also manages communication efforts for the Office of Rare Diseases Research. Prior to joining NCATS, Shah spent 2 years at the National Institute of Mental Health in its intramural research program, where she worked as a program specialist in the Office of Fellowship Training. And with that, I thank you both for being here today and presenting in this webinar. And with that, I'm going to turn it over to you and stop sharing my screen.
Thank you, Veronica. Appreciate the introduction as always. So I'm going to go ahead and share screen. As mentioned, hopefully you're in the right classroom. This is a session to talk about rare diseases, and I wanted to first start with just the agenda. We plan on going through an introduction, followed by discussing a little bit about the public health relevance of this topic of rare diseases, discussing a little bit about the foundations of rare disease research and some of the principles behind that, and then really going back to what patients and caregivers frequently want to know, as well as what resources you might find useful. To start, I just want you all to think about a story that I'm going to share right now. So imagine that you have a child and they've been growing up for most of their lives without any issue, and then all of a sudden something happens. It's unexplained. You're not sure how to really react to it. You bring them to the hospital. They do some scans, maybe take some labs, and at the end of that, really, we're not sure what this is what you hear. You're left kind of just confused. You're not sure. You're trying to follow up. You really don't know what's going on. And in the end of this, you really feel lost and alone. This is a story that frequently is seen by many rare disease patients. They oftentimes are dealing with the fact that both, on the one hand, their disease is rare, and it means that oftentimes many providers may not be aware about that, but there also may be very limited amounts of information that those providers even can have access to. Little might be known about the disease, let alone there may not be much research that has actually occurred in that disease at all. So frequently they may feel alone because they just don't know who to talk to. They may not know that the others out there that might have their disease, or again, where to even go to find information about that. Frequently, when we talk about rare diseases, you might hear about them perhaps from media through HouseMD. You might hear about them as the name that you would see behind some type of foundation like the ALS Association or the Alpha-1 Foundation. But what we don't realize is that when we're talking about rare diseases, collectively, it affects, these diseases as a whole affect almost 30 million Americans. That's about the same as the number of people that have affected by diabetes. So when we talk about rare diseases, oftentimes we talk about rare diseases in the context of our center, the National Center for Advancing Translational Sciences, as a translational issue. Translation is the process of turning observations in the laboratory, clinic, and community into interventions that can improve the health of individuals and the public. When we talk about research on rare diseases, research as a whole in rare diseases is affected by collective obstacles. Small population sizes, limited clinical understanding, and then all of this really stems to a lack of oftentimes research information available for that disease. Patients with a rare disease, on the other hand, face common challenges. So this leads to a lack of diagnostics, a lack of treatments, and oftentimes what we like to call a diagnostic odyssey, and we'll go into that a little bit more. So one update is we actually do have a small change in our office. We are actually now called the Division of Rare Diseases Research Innovation, and I wanted to share our mission. Our mission is to accelerate rare diseases research to benefit patients. So as an example, one of the events that we manage every year is the Rare Diseases Day at NIH, where frequently both clinicians, researchers, other government officials, as well as patients, patient organizations will get together, meet at the NIH, and discuss rare diseases. To start, when we're talking about rare diseases, well, what is a rare disease? A rare disease rare diseases in the US were defined by the Orphan Drug Act of 1983. That defined rare disease as any disease that's affecting less than 200,000 people in the US. This is a legislative definition. So if you think about the population almost 30 years ago when this, or 40 years ago when this act occurred, that population was 100 million less than what we see today. So if we were to convert 200,000 people in the US into some type of epidemiology rate, back then, that would have been about 8 in 10,000 versus today, 200,000 out of 330 million, that's roughly about 6 in 10,000. And I should note, because this is a legislative definition, that means that rare diseases are defined differently by different countries' legislatures. So in the US, again, this is less than 6 out of 10,000 people or so. In the EU, that's about less than 5 out of 10,000. In South Korea, 4 in 10,000. In Australia, 1 in 10,000. What that means is when we're talking about rare diseases, there is oftentimes a range of diseases we're talking about. So it's estimated that there's somewhere between 6,000 to 10,000 different rare diseases. And again, some of that is due to how you both define a disease and how different countries define what is a rare disease. When we're talking about these diseases in common, many of them, about 45%, are neurologic diseases or diseases that affect your nervous system. A number of them are developmental defects that occur when a child might be, for example, in utero. Number of these are cancers or neoplastic disorders. Some affect the eye, and very frequently, and many of them also affect metabolism. Now, in general, when we're talking about rare diseases, about 80% of them are thought to have some type of genetic cause or inheritance or relationship to that. So when we are thinking about systems such as All of Us that are trying to really provide lots of research on genomics, that's essential for us to be able to understand better the causes of different genes and causes of different diseases. So, that's what we're talking about with rare diseases and how many there are. Well, how rare are rare diseases? So they run the range. We have some diseases, a small fraction, that really run a higher range, closer to that 200,000 level. And then you have the majority of the diseases are really, really low in prevalence, or they may be less than 1 out of 1 out of a million. So if you think about with the US population, that means you have a disease that might affect less than 300 people. Some diseases affect maybe a few in the world. Now, when we talk about these, however, even though the majority of rare diseases are going to affect really small populations, because each of those are affecting really small populations, the majority of people that have a rare disease actually are those that have one of these more higher prevalence ones. So that's particularly one of the issues then we're talking about, understanding some of these very low prevalence diseases. What do we know about rare diseases? As I alluded to earlier, about 80% of them are thought to have some type of genetic relationship. Every year, we learn more and more about our genetics, and then we learn more and more about what causes, what molecular basis there may be behind many diseases. So only about 5% of these diseases have a therapy. And when we talk about why does it matter if a disease is rare, that's a really important point. Why is it that only 5% of rare diseases have an approved therapy or treatment? Part of that has to do with the fact that when we're talking about drug development as a whole, the drug development process can take many years, 10 to 15 on average, and cost billions. Now, this diagram here that you see in front of you is just really to show that this process, even though it looks like it's linear, you can have thousands of compounds that you're going through in this drug discovery, many different research animal models that you might have to go through, ultimately several different clinical trials, and you may not even get an approved therapy from that. So this is a lot of investment required to get to a therapy. What you're going to see on the screen next just shows you the volume of different activities that have to happen in order for drug discovery to occur. And I don't want you to fixate on any particular step in here. This is really just to show you how complex things may be. That explains why that part of the problem when we talk about rare diseases is a translational science problem. This is an issue about how do we create a business case for a disease where, again, it may only affect less than a dozen people in the entire country. So when we talk about rare diseases only having about, again, 5% of them having their approved therapy, in order to move this forward, we need to understand what's similar across diseases to develop multiple treatments at a time. We need to develop models that can better predict a person's reaction to a treatment. And we need to enhance the design and conduct of clinical trials so that the results more accurately reflect the patient population as a whole. These are issues that are necessary to tackle how we affect the entire field of rare diseases, rather than just thinking, how do we get one treatment out at a time? So in thinking about this translational science problem, we can think about some of the gaps between research and translation. So for example, this, what you see in front of you right now is a graph that basically just shows an increasing number of publications each year. And this is probably something that many of you as librarians are aware of, that we have more and more research findings every year. However, at the same time, we don't see a similar pace in terms of discovery and approval of new drugs. So what you see below is just the fact that there's quite a gap between the amount of research we have occurring on in publications and findings and understandings, but our actual number of approved therapies hasn't increased similarly. And then, as I alluded to earlier, rare disease patients oftentimes face very common challenges. This graph here is coming from a study that our office, our division had done around looking at some of the medical burden and the cost, healthcare cost of a disease. I don't want you to focus on any particular point here. What I just wanted to call attention to is the fact that it can take many, many months, if not years, to get diagnosed with a disease. And during that time, it's not that nothing's happening. You might be admitted to the hospital with certain symptoms. Your child may have multiple specialists they're having to be seen with, and they may have multiple different signs and symptoms that they're showing before the disease is actually even identified, let alone well managed. So as part of that, we talk about this as the rare disease diagnostic odyssey, because this is something that's oftentimes seen across many patients affected by, again, the many different types of rare diseases. As I alluded to earlier, it takes about almost 6.5 years before many patients receive a diagnosis. And then since the time that participants of a particular study that we're showing results from right here have reported their signs and symptoms, they've seen up to almost 17 specialists. We've seen anything from papers that have talked about, several dozen specialists required before they are able to find really a team that's able to provide good management of their patient's care, of their child's care. So much of this, again, this is just to provide some background details. What we wanted to focus in on is really thinking about the patient journey that a rare disease patient has to go through. On the screen right now are just two different diagrams that show that patient journey. One is from the National Organization of Rare Diseases, an umbrella organization that provides lots of support across different populations of rare disease groups. And then the other one is from our colleagues in the EU at Eurodis. And both of them, I wanted to pull your attention to a red box I have circled in the middle that shows that usually when a patient's starting this journey, after they initially start to show symptoms, their first step is oftentimes to go and talk to a primary care doctor. And really the next step after that is to perform online research or go to a library or look up information. What is it that, where is it that patients are seeking that type of information? Again, so this is results from one study, but there are numerous studies that concur with this. Oftentimes, they frequently, again, go to a medical professional, their PCP or specialist. And then after that, they usually turn to a charity or a support group or foundation, patient organization, as well as the internet. And I think this is where, when we think about what they're looking for, oftentimes it's trying to find the right doctor or healthcare professional to help inform them about who to talk to. They may be looking for these patient organizations that might be able to provide them insights into their disease, or they might be trying to find others that have similar signs and symptoms of them to get an idea of what is it that they should be expecting about doing moving forward, or where to go for support. And then oftentimes, again, this comes through many general internet searches. So at the NIH, one of the things we try to do across the different institutes and centers is really just to try to provide reliable online information. My colleague Mary Shah is going to talk a little bit about one of these resources, the Genetics and Rare Disease Information Center. Mary, if you go ahead. You're still muted.
Sorry, just trying to find the mute button. Thanks, Eric. So yes, I just wanted to give a bit of information about the Genetic and Rare Diseases Information Center, or GARD program, that we manage in our division. So GARD is a public health resource that was established by the Rare Diseases Act of 2002. And really the main mission and goal of GARD is to support patients, their caregivers, and their families by providing reliable and understandable information about rare diseases. Go on to the next slide. So anyone can contact GUARD. Priority is given to patients and caregivers, but we do have physicians, researchers, and sometimes students reaching out for information as well. And the public can contact GUARD by calling this toll-free number. If you can click, Eric, and they would be able to talk to an information specialist, or they can also use this contact form and receive a personalized email response back. There's no cost associated with contacting GUARD, and GUARD is accessible globally. We also have information available in Spanish. And all information specialists can help with finding individualized information for specific rare diseases, as well as different support services like disease-specific patient groups, clinical studies, or even resources for those who are still searching for a diagnosis. And I wanted to mention that information specialists make sure to convey that information they receive and communicate back is confidential. And if you can click, Eric, and it's not a substitute for a doctor's advice. Let me go to the next slide. Okay, so Eric touched on this briefly. I just wanted to go through the patient journey to finding a diagnosis and what information they may be seeking and what resources you could provide to assist individuals along the way. This graphic was developed by the National Organization for Rare Diseases, or NORD, and just provides a clear guide to steps an individual would take during this journey and what information they would be looking for. So starting at the top left, a patient first presents with some symptoms and visits their primary care physician and gets some initial testing done. And if you can click, then usually the patient would start kind of doing their own online research, especially if they didn't get any clear answers from their PCP or primary care physician. And this is when sometimes they would come to GUARD or possibly to you seeking some information or where to find this information. So after seeing their PCP and getting some initial testing done, you can click, Eric, the patient would be referred to a specialist of some sort. And here are some helpful resources. You can click, Eric, to assist the patient here. Many times the patient may not know what to look for when searching for a doctor. So this first link from Medline Plus provides information on choosing a doctor and what to consider when choosing a doctor. And on average, if you can click, Eric, on average, a rare disease patient is usually referred to 7 to 8 different specialists before finding a diagnosis. So the second resource here from Medline Plus lists the different kinds of healthcare specialists and has direct links to the professional societies where they can find specific specialists that are close in their area. But just to note, not all health specialists are listed here. So if there is a specific specialist a patient is looking for, sometimes the best place to start is by searching for the professional society for that specialty. You can click. So about 70 to 80% of rare diseases are genetic. As the patient visits these different specialists, they are most likely to undergo genetic testing or be referred to a genetics clinic. So this third resource I have provided here is from Medline Plus and can help the patient understand human genetics, and it kind of gives just basic explanations of genetics concepts. And the fourth link is to find a genetics clinic page from the American College of Medical Genetics and Genomics organization. And I just wanted to show a quick screenshot, if you can click, Eric, to this page, because you're able to search by location as well as filter through some of the specialty areas like pediatric, or if someone is specifically looking for genetic counseling. It's a really helpful resource. So you can click twice again. So after a patient receives their genetic testing results and they have a diagnosis or a possible diagnosis, or a lot of times still is undiagnosed, this may prompt them to do some more online research for either treatment options for symptoms or other resources like support groups. So this is another place where they would come to GARD or to you kind of seeking more information. You can click twice here. Thank you. So just to point out a few other resources that can assist the patient here and can also be found on GARD as well. Many patients seek assistance with finding other support service resources like financial assistance, disability assistance, and caregiver support resources, and that's just to name a few of them. Many newly diagnosed patients seek out patient support or advocacy groups that are disease or symptom specific. And also, if there aren't really any of these type of groups formed yet, the general or umbrella patient groups listed here can help patients and caregivers find others with the same diagnosis and kind of help create these patient communities. And then I wanted to mention that GARD also goes into explaining that participation in research can help advance the knowledge and understanding of a disease and can possibly lead to treatment. So this is why we provide information on getting involved in research and finding clinical trials. And if you can click one more time, I just wanted to end with one more resource that can be helpful. About 1 in 13 people are currently living with an undiagnosed condition. And this resource here, the Undiagnosed Diseases Network, or the UDN, can help patients who have gone through extensive testing with multiple doctors and who still do not have a definitive diagnosis, search for a diagnosis by working with a network of researchers and clinicians within the UDN. Thank you. Back to you, Eric.
Thank you. Thanks, Meera. So to go from here, I just wanted to mention and note, so the rare diseases research is really at a crossroads in some way. So as I mentioned to earlier, there's a lot of discovery and activity occurring in here. Even though I was showing a gap between where we are with discovery of new medications and treatments and the pace of research publication, I do want to note that over the last several years, we've started to see lots of new possible drugs and therapeutic options being basically sent forward to the FDA for approval. So what you see in front of you right now is a graph that just shows over the last couple of years in particular, the number of investigational new drugs or IND applications to the FDA has notably increased. In calendar year 2017, there was about 106 submissions versus in 2018, there's almost 206. And much of this is due to the fact that we're at a point now where there's more and more gene therapies and other types of gene editing treatments and therapies that are starting to be discovered and pushed forward for approval by the FDA. So in particular, again, to what Meera was saying, since many rare diseases have some type of genetic cause or origin, this is a very important time for research in this space. Now, the research evidence and some of the challenge that we face is that as a public health information center, the research evidence itself is constantly growing. So one of the challenges that we have is maintaining information on thousands of rare diseases. On the screen, we just have several different charts. One just shows the fact that, again, when we talk about the total number of publications, specifically thinking about PubMed and Medline citations, there are millions every several years just added to PubMed. And then in addition to that, when we talk about specifically rare diseases, the image on the right is a knowledge graph that shows that when we talk about the type of publications, for example, that we see in rare diseases, this can include, again, hundreds of thousands of publications over thousands of journals, many different research projects, and thousands of principal investigators or researchers. So the challenge we have is organizing all of this information across thousands of diseases. So one of the things I wanted to briefly talk about was just how do we go about making use of this information that's out there? So one of our hypotheses that we've been trying to investigate is, can we leverage all of these existing collections of research data on rare diseases to really support how we might be able to bring information to the public faster? So one of the things that we're doing over the next week is we'll actually be launching a new version of our website. I wanted to show a little bit about this just to give some insight into, again, how is it that we're the approach we're taking with this website. So one of the things that we're trying to utilize is a methodology called COPE, or create once, publish everywhere. So what we want to do is, rather than creating the same type of information that you might see in multiple different resources, we're trying to utilize the knowledge that's already found in existing rare disease ontologies or data sets that others have discovered. So as an example, one of the things that we're trying to do is really pull in information that others have gathered on signs and symptoms of a disease. And to start, right now, we're just trying to simply connect that to diseases and just show it as is from those research data sets. One of the next things that we have to do is really tailor this information to fit our audiences. Given our public health mandate for our services, one of the things that we're thinking about is, how can we go through this data and start to select terms that might make sense for a patient or caregiver audience in particular. This goes back to a principle called health literacy, which is really about, again, fitting what information we're providing to the needs of patients and caregivers, as well as their perspectives. So what we're trying to do in some ways is to look at, for example, if one of the main steps that a patient may have is to think about where is it that they need to go in terms of a specialist. One of the things we're trying to do is understand, is there information that others have collected about disease that we can use to interpret and apply rules over thousands of diseases to say, here is a possible specialty that you might need to go to. And then thinking about how we connect that to information we provide on our website. Part of it is also thinking about, for example, if you're going to have to likely see a geneticist, let's say there's a disease that is due to some type of chromosomal anomaly. And again, that means that possibly the diagnosis might need to be made via some type of genetic test. Can we just use that fact that that disease is a chromosomal anomaly to then interpret when we should be providing information about genetic testing? Similarly, if that disease is going to require you to see a geneticist, can we just connect this all together so that we can then provide you a link to that resource that Meera was sharing earlier from the Academy of Medical Geneticists and Genomics about where to find a genetics clinic or a geneticist? So really thinking about how we fit information together so that for a patient or a caregiver that's looking for it, that we can put all of that really at their fingertips. And that much of that, in order to do that on a website, involves a process called user experience or UX. And it's really about tailoring delivery of information to our audience. So part of that is our understanding of, for example, if we're thinking about information like some type of concept like age of onset for a disease, users might need to see that in more of a graphical form rather than seeing it in a textual form in order for them to best interpret it. Many of the users that we find going to our website now are oftentimes going to GARD through their mobile device or tablet. So part of this is also understanding how is it that we can create information in a way that they can make use of. So what we're trying to do with our website as an example, it's not try to create a fully polished product, but rather start with what we have right now as almost a framework that we can then use to create dialogue for users and say, how do we do better with this? How can we actually address the needs that you have? So as an example, one of the things that we have on our new website, which you can actually investigate if you go to the website itself and click on our beta, and you'll see this again launched in the coming weeks. We don't yet have filters on for a user that's wanting to search for a disease. All you have the option of right now is just to type in the name and search based off of that keyword search. And part of that's because what we're trying to do is test some of this out in the same time that we're also developing this resource. So we might be going to patients and caregivers in smaller groups and asking them, if this is information that we're sharing, if you want to filter and search for it, what is it that you're going to need to use? Here's what we have. Does that make sense? And then part of it is also just leveraging as we push things out onto that website, see how people respond to that and use it. If they're not actually making good use of it, then it doesn't matter how good of a job we do providing information. the question is really about how to help them discover that information or search for it. So again, that's just some insights into what we're trying to do from a website angle in thinking about modernizing and approaching how is it that we address providing public health information on rare diseases. As was mentioned earlier, there are a number of different resources that our office, or sorry, our division, I still have to get used to that myself, have available for both patients as well as patient advocacy groups and organizations. So one, as mentioned, was GUARD, which is targeting patients, caregivers, and members of the public in general with public health information. It maintains both a contact center that provides individualized support and a health information website that just provides general information and links to where to find resources for support. And again, that website will be, a new version of that will be launching soon. If you wanted to visit that, that's available at rarediseases.info.nih.gov. In addition to that, we have a couple other resources that are more targeted towards patient organizations. One is called the Toolkit for Patient-Focused Therapy Development. That one is designed to help explain about the research and development process. It was an educational website that gathers a number of different best practices and resources to really help understand what a patient organization should be doing to get started with creating some type of research mission for their disease area. This was a product that was developed from the rare diseases community, but is really accessible for anybody, even patient organizations that aren't affected by a rare disease. Lastly, we have the RADAR, or Rare Diseases Registry Program, which is a similar approach as Toolkit. It's an educational website that provides general information and resources about how to start a registry. And going back to a little bit of what Meera was saying earlier, one of the most difficult first steps, and the reason why there's not frequently that much information known about a rare disease, is that you have to first gather patients that have that disease and be able to then recruit them into a clinical trial. So part of what we try to frequently emphasize is best practices to help organize patient communities so that they can work together closely with researchers, because frequently what you will see happen is that one of the issues that is seen in the rare disease space is unless you are very closely partnered between patients and researchers, that's usually where some of the gap also occurs in discovery. If you only have a disease that affects less than 100 people in the entire country, let alone the world, it's requiring a good number of them to participate in a trial is incredibly important to making sure that the research work you're doing is actually relevant to that disease and then in that disease, that patient community. So that's another resource that's available. The toolkit can be found at toolkit.ncats.nih.gov. And RADAR, the Rare Disease Registry Program, can be found at registries.ncats.nih.gov. So this last slide just provides, again, those 3 links, as well as Meera and my email and contact information. So you can reach us by emailing us at meera.shah@nih.gov or eric.sid@nih.gov. So this concludes the general lecture part of this presentation, and we wanted to really open it up to questions that you may have. Thank you. So I see that there's one question on the Q&A regarding, can you share with us your thoughts on the value of having websites and resources like patients like me? So again, I think there's a lot of both opportunity here, as well as a lot of, how do you say, there's a great opportunity with many of these different patient resources and websites that are available, because, for example, again, our problem that we face in designing public health information is how do we do this at scale? We're talking about thousands of diseases. There's limited ability for us based off of the amount of resources we have to focus on each single disease as much as a patient organization might be able to do. And then similarly, one of the advantages that patients will have frequently is trying to connect with others to learn about their experiences and also to try to find access to similar, for example, resources or even physicians and specialists that might understand their disease enough to support them. One of the main benefits of many of these different patient-focused websites and resources is really just helping create that community so that patients, again, don't feel alone in their struggle. One of the things we hear over and over again from many patients is that one of the challenges they face is finding a physician or a healthcare provider that understands their condition and can also act as almost a champion for them. The difficulty that they have is that when you have, for example, a disease that no one really recognizes, you can struggle with both having people correctly interpret the fact that this is not just in your head, or this is what you're experiencing is is connected to some type of disease process. That's one of the areas where I think, again, finding the right type of access is really important. And again, that's where some of these different patient organizations, as well as these different types of website resources are very useful. At the same time, one of the challenges that we have in the field right now is how we also navigate through misinformation. With rare diseases, because there may not be much known on them, or because they may actively be still in the process of being understood, part of it is that the information for a rare disease can rapidly shift with publication to publication. So, that's one of the difficulties we have, both in terms of interpreting information, but also making sure that people understand what is oftentimes in research might still be early in discovery and might not be set in stone. So that's some of the difficulties that oftentimes we see with the challenges of these different programs as well. I don't know, Meera, if you had anything you want to comment about that. And then,
no, I think you said it well, Eric.
Thank you. And then there's another question here about the new GARD website seems like it'll create very useful information routes. Is it possible to utilize health data standards or terminologies, SNOMED CT, ICD-10, et cetera, to promote interoperability and the ability for other resources to link to the info routes developed within the new GARD website? Definitely. So that's actually, I'll try not to get too focused on some of the informatics parts of that. But one of the things that we're challenged by is really this big data world that we have in front of us now. So interoperability is hugely important for us. What we don't want to do is we don't want to make it so that you're not able to really connect information on a rare disease, especially knowing how disparate information is. One of the things that we're trying to do is we're trying to connect some of these different health data standards, so ICD codes or codes that you would see used in an EHR to rare diseases. And unfortunately, the problem that we face is that not every rare disease has an exact code for it. Because again, as an example of ICD, that's a billing code that's used to connect medical encounters, patient encounters, to ways for physicians and to be able to bill for their work, their procedures that they're doing, or the diagnostics and other evaluation they're having to do. So if you have a disease that only affects 12 in the world, how do you fit that with a code? So part of what we're trying to understand is, what diseases have what codes, and how do we connect this together into, again, some type of network of data that then each of us can make use of. Hopefully that answers your question. And Meera, I know you also wanted to say something about that.
Nope, I was just gonna, because there's a couple of questions coming in. So nope, I was just gonna mention that.
Okay. So when is the new GARD website launching? So this is, I've been chasing at this for a while, so I might have lost some hairs the last coming several weeks on this. Hopefully within the coming week is our plan, but right now I don't want to give a express timeline, because what we're trying to do is just to make sure that when we launch it, again, we want to be able to be ready to start working with the folks that are visiting it to start modifying and changing and adapting it to them. Our goal really is over the next coming year just to continue to work on the site to make it fit better the rare disease patients and caregivers that are going to be using it. So hopefully we'll have it out soon. Again, I'm keeping my fingers crossed, but now that I've said that, every time I give a date, I feel that it's always then going to be caught by some type of IT bug. So, I keep my fingers crossed on that. But you'll be able to see that soon. If you want to hear information about the launch of the site or other information from NCATS, just go to ncats.nih.gov, and you can sign up for more announcements of information, and we'll release information there as well. Another question Is there a workbook type resource to assist families on their journey to finding a diagnosis? There are a number of different resources like that that are available out there. Meera earlier had pointed to several different patient organizations that were, again, we like to refer to these as umbrella organizations because they don't focus on a single rare disease, they focus on the field. A number of them have created resources that are helpful about walking through the process of finding a diagnosis. And then, another thing I wanted to kind of note about that is the difficulty here is we're talking about thousands of different diseases that may be connected by just the fact that they're rare. They oftentimes are very, diverse in terms of their both causes or etiologies, their signs and symptoms or phenotypes. And again, it's very hard to wrap it all into a single journey, but there are parts to that in common, many of these different umbrella groups provide resources to. The difficulty that some individual diseases may face, and this is part of one of the other programs that Meera had mentioned. There was a resource developed called the Undiagnosed Diseases Network, is because of the fact that sometimes, especially for those diseases, again, that 1 out of a million, that just are really hard to explain. It may not just be that again, there's no information out there because no one's actually discovered the understanding behind a disease process yet. So those are some resources that have been developed to help basically connect patients directly into some type of research trial to help understand their condition. Meera, would you like to add to that?
No, I think you said it well. There's also resources out there to help children and in the schools as well. So those are some good resources to look up as well. Eric, there was a question that came in while you were still presenting, and I just wanted to see if you had anything to add to it. How has the pandemic impacted rare disease research? Talking about the amounts of IND applications, trials, publications, etc.
Yeah, I think that the pandemic has created a lot of interesting kind of opportunities as well as challenges. The opportunities is that we've been able to see the ability of really our entire nation to kind of focus on its entire research infrastructure on a single issue, and a lot of the previous issues about getting researchers, for example, to work together and share information, to work in interoperable data sets. A lot of that has been stuff that I think the pandemic was then led to a lot of innovation and solutions in terms of that area. Where we see challenges with rare diseases are, for example, during the pandemic itself, a lot of specialty clinics may not have been accessible. So there are probably a lot of patients that otherwise would have been diagnosed that may not have been able to reach those services during the pandemic. Similarly, a lot of studies and clinical trials that were in process at the time were really reliant on patients being able to transport themselves to the clinical site. As we shifted into then basically focusing on the pandemic, we've also seen a shift in terms of thinking about how patients can enroll in clinical trials and whether or not there's a need for a distribution of sites so that rather than, for example, if you can't take a flight to a certain area, if you're in a rural region, how do we make it so that you can still access a clinical trial? You're still able to provide your information. So there's been a lot of challenges and opportunities there, and it'll be interesting to see how hopefully some of this moves many different rare diseases forward in terms of either opportunities or technologies that we may have accessible for them in terms of research. Hopefully that answers your question. So there's another question just submitted. When knowledge of a rare disease goes viral, such as the ALS Ice Bucket Challenge a few years ago, are there challenges in making sure that the rare disease field resources don't get sucked up by the popular disease, or is it more of a benefit for the field as a whole? There are opportunities and challenges as well as everything. I think the Ice Bucket Challenge was a good example of where we were able to draw a lot of public interest in a particular disease. And I think, again, in general, one of the issues faced is that there are so many diseases out there that it's almost, it's impractical in some ways of thinking of how we raise everyone's attention about every single one. So part of what we try to do, and this is why we titled this session, Rare Diseases Not Rare, is that we need to talk about the struggle of these different diseases in common so that we can try to find ways to address as many of them altogether as we can. One of the things that we're trying to think about are, rather than thinking of each individual disease as completely separate, we try to think of where there might be overlaps between them. So, for example, in our rare diseases clinical research network that our division supports, it's a grant process where instead of the typical model where a principal investigator or researcher has to submit their research proposal based on one disease and kind of one study, the researchers involved in that network must be working together on several different diseases aligned on some type of concept. Either they're dealing with a similar physiologic process, maybe they're all the same type of disease. For example, they're mitochondrial disorders. They could be involving a similar gene or phenotype, but we try to encourage researchers to work together and collaborate. And again, looking at multiple diseases in common, so that way, whatever they're doing is hopefully scalable across more than just one disease. And then we have another question here. Do you think that the general public having access to consumer genetic testing has changed or challenged the diagnosis and identification of rare diseases? That's an interesting and tough one because, again, for example, because a number of different rare diseases still don't really have clear enough research work on them, we may not even have a defined genetic test or a diagnostic process for them. A number of different diseases are still really just being understood. So what that might mean is that we're at the stage where the only research that has occurred in a particular disease may have been what we refer to as case reports or case series, where a provider might or a researcher might be providing a description of a single patient encounter or a single patient experience that they're able to share in a publication. It takes that's the first part of how you might define a disease, but really to be able to establish this, we need what's called a natural history, which is where many different patients that have the disease, you're able to take their information in common and then really present a more kind of unified picture of how that disease process might be occurring and what signs and symptoms, for example, it may have. So that's some of the challenges that we have, is that not every disease has that natural history information available in research, and therefore we may not be able to even have some diagnostic for it. I think in general, consumer genetic testing has definitely created opportunities for the public to be able to interpret the disease information that they otherwise may not have had access to. The difficulty, again, is really how close you can then connect that to a diagnostic process. So that continues to be a challenge. The FDA recently, about a week ago, had provided a warning about some genetic tests around in utero that were non-diagnostic. These were screening tests because, again, there's only so much you can interpret from some of these tests, and they were trying to caution the public from using them as a diagnostic instead of as a diagnostic support tool or a screening tool, using them as an actual diagnostic confirmatory test and saying you have this. So again, that's the difficulty with some of these consumer genetic tests, is that they may provide risk assessments, but that doesn't substitute the need for them to still see a physician or a clinician to receive a diagnostic. And again, the challenge in rare diseases is having enough research information to get to that point. And Meera has been monitoring chat, so I just want to see if there's anything, other comments or questions.
There was one question about the publication therapy gap is in any part due to publish or perish mindset in the academic spaces.
Yeah, that definitely may play a role. I think, again, the difficulty we see with rare diseases is even just trying to find interest in them. So frequently, for example, many patient organizations will try to look for identifying like a champion, for example, a new principal investigator that they can get to be interested in their disease, because usually the only ones that are really focused on their disease might be that patient community itself. So researchers may come and go with grants and the type of grants that are available. And that's where we frequently see some problems. So as I alluded to earlier, if you had a disease that maybe has a number of different case reports or a case series on it, to really get enough researchers and enough momentum around a natural history study takes a lot of investment. So that's where this close partnerships between patients, patient community, and researchers is really vital to being able to see research activity occur in a disease. So I just wanted to, I think we're now out of time, so I wanted to go ahead and hand it back to Veronica.
All right, thank you so much, Eric and Meera, for that wonderful presentation and sharing these great resources and answering everyone's questions. So yeah, once again, thank you so much. I'm going to share my screen real quick. Okay. So, this program was made possible by the National Library of Medicine, the network of the National Library of Medicine, and the All of Us Research Program. Going forward, we hope to provide more trainings and virtual programs like this to increase awareness of the importance of biomedical research in understanding medical conditions and genetic diseases. The All of Us Research Program hopes to advance medical breakthroughs and knowledge through precision medicine and understanding more about all the factors that affect people's health. And again, you can learn more about the All of Us Research Program by visiting joinallofus.org/NLM. So in the chat, we are sharing a link to the evaluation survey. We encourage all attendees to complete the evaluation survey and provide your feedback. Your feedback matters to us, and it will definitely shape the future of webinar and virtual programs that we provide. For those that were interested in continuing education credit for CHIS or for CHES, once you complete the evaluation, it will give you instructions on how to claim your CE credit. But again, even if you're not interested in the continuing education credit, we encourage everyone in attendance to complete the evaluation form and provide us with your feedback. And again, that's all we have for today, but I want to thank you all for attending. And once again, thank you, Eric, and thank you, Meera, for that wonderful presentation and for providing us with this training today. For all the attendees, we will be in touch with class materials, PowerPoint slides, and a link to the recording when it is ready. Thank you.
Thank you all.
Thanks.
Thanks, everyone.